Welcome to Conversations with Perinatal Psychology, talking about maternal mental health because your mental health matters for both you and your children. So today our discussion is around mother and baby mental health units, what they are, how they provide support and who might access them. So I'm Dr Natalie Hulme. I'm a clinical psychologist working on the mother and baby unit in Winchester, and today I've invited two people to come and talk with me who have a lot of knowledge and experience to share with us about the role of a mother and baby unit. So I'd like to introduce you to Ellie and Lisa. So Ellie, would you like to introduce yourself and tell us a little bit about your role on the MBU?
Hi, I'm Ellie. I'm a mental health nurse. I've worked on the MBU for just over 2 years now. I was here as a student and I liked it so much I decided to stay. And yeah, I think that's about me done.
I'm Lisa. I'm a childcare practitioner here on the ward. I've been here for just over 2 years as well. I basically am supporting mums with baby development, baby care, sleep, weaning, all aspects really.
Everything baby related.
Everything baby related.
So to focus our discussion today, we decided to ask the current mums on the unit what questions they would like to know, what they would have liked to have known before they came to the unit, what they thought would be helpful, and we're going to use that to focus our discussion today. So we're going to have a little bit of think about some of the questions that the mums asked us. So first and foremost, quite obviously, what is a mother and baby unit? So a mother and baby unit is a specialist unit where women are admitted who are experiencing perinatal mental health difficulties. They're admitted with their babies to receive specialist treatment while they continue to care for their baby. So it's a place really that women can be admitted and stay connected to their baby during a period of mental health difficulties. And for us, women can be admitted from pregnancy. I think it's third trimester for us, isn't it?
So unlike other mother and baby units, we can admit from 28 weeks. Most mother and baby units will admit from 32 weeks gestational age.
Yeah, and babies and mums can stay with us up until baby's about a year old. Yeah. And I guess mental illness at this crucial time, I suppose during this perinatal period, it can really affect the mum's relationship with baby, really undermining women's confidence and their ability to cope and be a good mum. And we see that quite often on the unit, don't we?
We do, yeah. It's about, like you said, keeping mum and baby together, regardless of how much or little care mum's able to provide. We're here to fill in the gaps, so to speak, and support.
Yeah, and we've got specialist training, so all the staff on the unit will come on a little bit more to explain roles, but are specially trained to support mums during this period, to both kind of nurture and support the mother-infant relationship at the same time as mum being able to receive treatment for her mental health difficulties. And I guess the importance of supporting that relationship during this time in terms of a baby's cognitive, social and emotional development has been shown time and time again within research. And that's why mother and baby units exist, to enable both mums to get help with their mental health, but also to stay connected to their babies. I think there's about 19 units across England, isn't there?
Yeah.
I'm not sure whether there are any in Wales at the moment.
So there is one in Wales, there's one near Cardiff, and there's a campaign at the moment to get some in Northern Ireland, and there are also some mother and baby units in Scotland as well.
Fabulous. So we're Winchester based, but women can be admitted from different areas of the country.
Yeah, so Perinatal Mental Health Services for MBUs, it's a national run programme, which means that anyone in the country can find and get an MBU bed, as there are so few in the country. So that means that we can have people come from Staffordshire, Oxfordshire, sort of anywhere. It doesn't just have to be Hampshire.
Yeah, and often what we do is try to keep mums as close to home as possible. So it might be that you're admitted to a unit, but if a bed becomes available in your local unit and that's what the mum would choose to do, we would hope to transfer you back more locally. So the next question that our mums were asking was how many mums and babies are usually on the unit?
So on our unit, we have 8 beds. So at any one time, we can have up to 8 mums and babies on the ward. Sometimes we have had mums which have had twins.
Yeah.
I think we've had one set of triplets.
And I guess another question was about the ward environment, kind of what the rooms and what the situation on the ward is like. Ellie's one of the nurses around a lot of the time, so tell us a bit about the ward environment.
So at the moment we are an 8-bedded ward and we will remain that, but we are getting a refurb, so our ward, sort of how we look at the moment, is quite different. But all rooms have an ensuite bathroom, so you have your bedroom, you have, a bed, storage facilities to store clothes, to store baby nappies, things for baby as well. And then adjoining onto your room, you have your own bathroom. That includes a toilet, a sink and a bath and a shower. And that's for sort of all the mums and every single room. And then we also have a milk kitchen where you can prepare bottles, sterilised bottles, if you are, not breastfeeding your baby. We have a kitchen where you can cook meals if you would prefer to have cooked meals instead of having meals provided by the ward and the unit. We also have a lounge area where mums can sit and relax and watch TV, engage with peers. We have a nursery as well where, babies can sleep if it's needed. And that may happen the first couple nights, but we would hope that babies would go into mum's room after a certain period of time just to help with that connection and that bond. And we would also have a therapy room and a one-to-one room where meetings can take place, so by meetings with the psychologist or the psychiatrist. But also you might have, discussions with the CCPs, so childcare practitioners, or with the nurses sort of throughout the day and night if you need any sort of support.
Yeah, and we've got a little garden that's undergoing a refurb as well, isn't it? So we've got a little bit of outside space that is accessible throughout the day with a little bit of...
And private just for our ward, for mums and babies' use.
Yeah, and I think a lot of our mums do quite like the communal areas, don't they? Because I guess a part of admission is about gaining some peer support and forming some kind of peer relationships on the ward as well. So the communal areas are often used for things like joint films and watching TV together, as well as, just sometimes in non-COVID times having visits as well. And I guess we've kind of talked a little bit about the different staff on the ward, but some of the mums were kind of wanting to know, what kind of staff work on MBU and who can the patients expect to see in and around the unit?
So I'm a mental health nurse. I'm one of many mental health nurses on the ward. We all have different training, different areas of expertise. People have worked different places before coming to the mother and baby unit. So we've all got a lot of knowledge. We can help. We can do psychological therapies with people. We can, help with, informing about medication, doing sort of any sort of nurse role that you need while you're on the ward. Most of the time, but all the time when you're here, you'll have shifts that are run by nurses. You'll have the nurse in charge that you can go to if you have any issues, if you need any support, if you need, things organising or help contacting other people, like other services. There's always nurses around that can help you with that. Currently, we also have healthcare support workers that sort of help the mums, do things like laundry or sort of any activities of daily living that someone needs to do or needs support with. I say currently because our standards are changing to go to just nurses and CCPs supporting a shift. And when I say CCPs, I mean childcare practitioners. And Lisa can talk a bit more about that.
What's a CCP, Lisa?
So childcare practitioners, again, we're trained in all areas of baby development, baby care, again, supporting and giving mums the skills and confidence whilst on the ward to bond and take care of baby with discharge in mind, so that once mum and baby go home that they feel able to carry on with the baby care at home confidently.
Yeah, because we said, didn't we, that a lot of the time the mums come on the unit and even though they might be able to do the baby care, they've lost their confidence because of becoming unwell. And you guys support them to gain that confidence back up again.
Yeah, and it's very much working in partnerships with the mums, because we don't want to be de-skilling or taking over anything. It is very much, mum and baby, and where we can help to support and guide and help alongside mums and dads.
Yeah, we also have, I guess we have a range of other people, don't we, that, aren't necessarily here to talk to us, but we have the psychiatrist on our ward who would be often kind of having a particular expertise in medication in pregnancy and breastfeeding. And we might have junior doctors who would be there to support both the mental and physical health of the women on the ward. We have a health visitor as well, just as you would in the community. Occupational therapist in terms of supporting activities of daily living, and myself, a psychologist, so kind of offering the talking therapies or a safe space to explore your experiences, looking at offering a way of making sense of your experiences, the things that might have brought you into hospital, and considering ways forward. So we offer a range of therapies. And as Ellie kind of pointed out before, that not all psychological work has to be done by the psychologist. There's a lot of psychologically informed work done by our nurses, and we offer a range of modalities, both focused on the individual mum, but also on the mum-infant relationship as well. So there's a real wide range of people that you might see on the ward. Another question was around how long mums and babies stay, which is a particular thing that we know Ellie knows a lot about. We've done lots of audits and research. So
yeah, if you ever come to Mother and Baby Unit and meet me, you'll know that I love outcomes and paperwork. That's what everyone knows me for. And sort of looking at people that stay, it really does vary. It varies between if you're an out-of-area patient, it varies between sort of what diagnosis you may have. But on average, mums stay about 5 to 6 weeks here, with normally some periods of leave. So it wouldn't be that you would stay for 5 to 6 weeks, you know, here the whole time. You might have periods of going home, and that's what we'd like to do, is sort of do things where it's a graded approach home, because we know that being on a ward, it's a bit of a bubble. Everyone calls it a bit of a bubble. You don't necessarily have to cook. You don't have to look after maybe other children or other family members. You don't have to worry about maybe things that you'd worry at home. And then going back home, that can be a bit of a shock, and people can really feel that. So normally we'd sort of suggest sort of graded periods of leave, but it doesn't have to be 5 to 6 weeks. People can, you know, stay longer, they can stay shorter. I mean, it's really sort of where you're at that time of being on the Mother and Baby Unit.
Yeah, and I guess that answers one of the other questions that the women had, which was whether you can take leave from the ward over the day or overnight. And as Ellie's been saying, we would, you know, generally recommend that women do that when they feel able to, starting maybe just with the local leave around our area, maybe kind of having some leave out into Winchester, but thinking about day leave home and having some gradual leave before discharge. So yeah, definitely women can leave the unit in line with care plans, depending on what their kind of difficulties are at that time.
It also helps because we have mums that come back from either day leave or overnight leave, and we can discuss things that went well and things that they may not have felt so confident about, or may have struggled with, things that they hadn't necessarily thought of when they've been on the ward, where there's been people around to help support. So that can be helpful.
Yeah, because you don't know what you're going to find difficult until you go home and are faced with it. And so that's why it's usually built in as part of the care plan, isn't it? And I guess kind of maybe linking to that a little bit is maintaining those connections with people who are important to you in your outside life. So one of the questions our mums had was whether they could have visitors. I suppose in line with COVID guidelines at the moment, that can be changeable. However, we always, dads aren't considered visitors on our ward. Dads can always visit, or partners can always visit, because it's really important for their relationship to be maintained as well with baby. We also encourage kind of other family members and siblings to visit where guidelines allow, and also encourage our women to have time off the ward with family and friends, because it's really important to maintain those connections. Because a bit like Ellie said, the ward can be a little bit of a bubble, and you can feel a little bit disconnected from the things that are important and that you value in your life. So visitors are definitely something that we support, depending on our COVID guidelines at the time. And that links in with another question about what kind of support is available. And I guess, I don't know what you guys think, but we try to take quite a holistic approach, don't we, on the Mother and Baby Unit? So considering like the role of medication, but also the opportunity to engage in talking therapies, opportunity for less formal space to reflect as well, you know, one-to-ones kind of with nurses as and when you need them throughout the day. They don't have to be formal. Opportunities for problem solving, some very practical issues, some kind of support around childcare, advice, peer support, opportunities to connect with other mums, and reflective sessions and support to increase confidence. But in terms of specific activities, so Lisa can probably tell us a little bit more about the specific kind of childcare practitioner activities that are run on the ward.
Yeah, so with Mum and Baby, we explore things like messy play, baby sensory, rhyme time. We do baby massage, baby yoga, and these are either in groups or one-to-ones, depending on what mum likes. Bonding activities with babies. We also do a baby's cues workshop and a weaning workshop, can support the mums to go out for local area walks as COVID restrictions allow or not. We have done some trips to the library with mums and babies so they can access the story and rhyme time, just obviously doing rhyme time and things on the ward, but also then going out to the library so mums can access that. We talk around safer sleeping advice and do the icon coping plans about when babies are crying and when you're at home and what to do.
So basically everything that you can kind of get access to in the community, we do try to recreate to some degree on the unit.
Yeah, and some of that, like I said, is on a one-to-one basis or in a group to sort of almost like you said, what you do out in the community, so sort of like baby groups that you may attend out, we try to recreate on the ward.
Yeah, and I guess we've also got things like our therapy groups as well, haven't we? So we run an emotional coping skills group on the ward at the moment. We have things like reflective parenting, which is an opportunity to connect and reflect with other mums about the challenges of parenting. We also offer kind of more activity-based things for the mums. We sometimes try to do the cooking sessions or the arts and crafts things, don't we, as and when, depending on the mum's interests on the ward. So there's a real range.
Have a bit of
Karaoke and film nights we've also done. Yeah.
Quiz nights.
Yeah.
I'm quite a fan of a quiz.
Kind of create that kind of safe, secure environment for women to recover from these kind of episodes of perinatal mental illness, I guess. So there's kind of a wide range of support available. One of the practical questions our mums kind of wanted to ask, which I know is, we're not necessarily going to reel off the whole list, but in terms of kind of what to bring and pack for baby, like what is it that the ward provide, or like what, if you were thinking of coming to a mum and baby unit, what would you need to bring with you?
So basically we just say to mums coming in to bring baby nappies, baby wipes or cotton wool, depending on how you want to clean baby, anything that's like your barrier creams, if baby's formula fed, to bring your formula of your choice and bottles of your choice. We do have sterilisers here. Obviously that vest baby grows, baby clothes, baby toiletries, dummy or pacifier if baby has any, baby's red book and medication that baby may be on. We have cots on the ward and bedding, just maybe a sleeping bag or push chair, car seat if you need to bring that in if you're planning on going out on leave.
Just everything you need basically for your baby if you were going to visit anywhere else, isn't it?
Yeah.
And I suppose that can be useful for women to know that, they need to bring their own things, and we've got the big basics.
Yes.
But it's individual to the baby what they individually need. We've got toys and things in our nursery, haven't we?
We have toys, play mats and things that that they can play with, which is all accessible.
Yeah. And in terms of mums?
Well, I was going to say, just in terms of babies as well, we know that sometimes mums don't have a lot of notice. There could be, there are mental health conditions that happen quite quickly, and that might mean that you have to come into hospital quite quickly. And that could be through, coming in and voluntarily, or it could be that you've, been assessed by a team and you've been, detained under the Mental Health Act. But if you are coming into here quite quickly, we do have some supplies that would last you overnight. So if a loved one or yourself comes in, unexpectedly, it wouldn't be that we wouldn't be able to provide, these necessities for the first sort of 24 hours or 12 hours that you're with us, because obviously it's important that you're here. So we do have emergency things if needed. And then for mums, it's any basic stuff that you would need. A lot of mums come in with quite, like I said, a lot of basic stuff when they first come, but as you know, as I previously said about how long people stay, normally in the second week we get another package, and then you start getting more and more packages, and then before you know it, you've got most of the things in your house, in your room. But also it's important to know that you can also get deliveries here. So if you did live far away and it was, or even close, but it was hard to get your necessities, so maybe more clothes or food that you like because you didn't like the food, or any sort of thing that you needed, we can have things like Amazon deliveries, clothing deliveries, anything that sort of you need can be delivered to the ward. as if you were at home.
Yeah. And I guess a lot of the questions our mums had were quite practical, but then I suppose it's quite an unusual thing to be thinking about, isn't it? In terms of a lot of the mums wanted to know more of the practical kind of things because of your basic needs. And unless you've got your basic needs met, it's very difficult to come in and kind of allow yourself to be kind of supported for your emotional needs as well. So I think it's useful for people to know. I'm trying to think if there were more questions that our mums asked. I mean, in terms of, we're hoping to do more of these kind of podcasts in terms of specific mother and baby kind of issues and things that people might want to know. But today we thought we'd just focus on some of the practical things, what a mother and baby unit is, you know, who might access them, and how we provide support. So we hope that we've answered some of your questions around that, and that you found it helpful to listen. So thank you to Ellie and Lisa for coming and sharing their experiences with me. Just to say, though, before we end the podcast, that if you've been affected by any of what we've talked about today, then you can access support through your GP, your health visitor or midwife, or you could even call 111, who've got mental health experts on hand. You could go to the Southern Health website and the Help in a Crisis link, which has a list of local supports. Thank you for listening to our conversation with Perinatal Psychology, and we've been talking about maternal mental health because your mental health matters both for you and your children. So thanks for joining us today.